Alright, big update regarding negligent providers. I had firsthand experience dealing with. I have a big video coming up where I'll look at this latest development in greater detail. According to a press release out of the U.S. Department of Justice, dated August 3rd, 2026, Medicare Advantage provider Complete Health to pay $14,100,000 to settle False Claims Act suit. This puts to rest a whistleblower lawsuit that was actually filed out of Birmingham, where Complete was accused of submitting false diagnosis codes for its senior patients to the Medicare program in order to profit. They were taking advantage of the elderly. My own assessment, by way of personal experience, is this is only the tip of the iceberg when it comes to corruption issues concerning this provider. I want to talk about a subject that nobody's mentioned in this case thus far, and that is Dr. Ronald W. Helms Jr. of Pell City. Now, Helms was the founder and CEO of Northside Medical Associates. I visited their Trussville location and saw a couple of their nurse practitioners in 2020. Now, in October of that year, Northside merged with Complete Health. And according to the press release, it said Northside had 4 medical office locations, 12 doctors, 16 nurse practitioners, serving tens of thousands of patients per year, and an 80,000 square foot facility in Pell City, branches in Moody, Springville, and Trussville. The details of the business acquisition were not made public. Helms went on to be a regional manager in the area. Now, there were a lot of criticisms by employees on how Complete Health was run after the merger. I'll give this example from the Indeed.com website. In 2024, a currently employed healthcare specialist wrote this review: worst corporate leadership team, lack of cohesive team playing. Among the critiques, they cite unprofessionalism, entirely too many C-suite positions, vice presidents and directors, poor leadership, poor stewardship of finances, lack of adaptability to target population in each clinic location area, full of liars and unqualified directors, no team approach, encourages employees to work against each other, and no support from anyone. So the story of CEO Dr. Ronald Helms is a very curious one. In 2025, Helms abruptly resigned from his new role in Complete Health. The circumstances concerning this are not well understood. With this latest Complete Health settlement with the federal government, the degree of involvement, if any, with the Northside Medical Associates locations is not well understood. Dr. Helms resurfaced last year when he opened a new medical practice called Helms Healthcare in the small town of Vincent. He has since expanded this back into Pell City and opened a location there in May, a 7,500 square foot facility. I had some visits at the Complete Health Trussville location at 7201 Happy Hall Road, Trussville, Alabama, 35173. This is just off Deerfoot Parkway. Most recently, in 2025, I regrettably had to deal with this location again for a family member, and there I made a startling discovery. The office has adopted a rather unethical and unprofessional practice of using representatives to speak to the public who discuss health information and are responsible but go by pseudonyms, nicknames, and outright refuse to give identity when requested. I visited 2019-2020 when it was called Northside Medical Associates. Referred to MRI in the same building, billed by St. Vincent's Ambulatory Healthcare Network, LLC, $500. The radiologist misdiagnosed injury that appeared in those images. 10-year honors graduate, neuroradiology specialist, Dr. Michael Brant Ruff, MD for Vulcan Imaging Associates, did not note the broken skull bone or 6 inches diameter infection that appears in the pictures. You can see the actual MRI images I am referring to in this video. I had many problems with the nurses I saw here, acknowledging the very serious injury I had: broken skull in the area of the occipital condyle condylar canal, possibly foramen magnum, head trauma infection, so 6 inches diameter visible in the MRI. I almost did not make it trying to deal with this injury. Doctors and nurses who were trying to mislead me in this very vulnerable time period, especially when I was paying them money for medical services, this was not appreciated. Curiously, when the nurses seemed uninterested in examining me, I was not referred to the MDs in the location like Dr. Scott Boykin. So what happened here? Did they patient dump me? I saw nurses Frankie James Crum and Celeste Richardson referred to the MRI by Crum. The MRI tech for St. Vincent's misrecorded which side of my head and neck my pain was actually on in her notes. Crum was attentive. I thought he was going to help me. He stuck an instrument in my ear and could see visible infection and swelling from the 6-inch mass in my head, and that same infection appears in the MRI. In his notes, that's written down and recorded. Crum saw the MRI pictures and everything changed. Probably realized I had a $1 million head injury. After I told him about the antibiotics effects in the next visit, he sounded in a panic, repeating, we're done, and the exam ended. This was an extremely disheartening experience. I was not done because I still needed treatment for a possible critical injury that almost cost me my life. Yeah, Crum kept talking about physical therapy, and he wrote some critical observation about my concerns of seeing a physical therapist. And yeah, it's really simple, okay? You have a broken neck, broken skull, a broken foramen magnum, you can go into physical therapy. Alright, you just think about this for a second, alright? I was told by the Northside Medical Complete Health staff that the results of the St. Vincent's MRI were normal, negative, and contained no injury. And this is not true. And I brought this up to Nurse Crum and Celeste Richardson. Unfortunately, they did not take my concerns that seriously. Money's paid for services. I obtained imagery from the scan and my records and found I had serious head trauma in the basilar area of my skull. I made Northside Medical Associates aware of this and even called CEO Dr. Ronald Helms of Pell City. My phone call was never returned. I believe there was substantial talent in this practice to help me, but they did not. Nurse Crum told me he was going to call St. Vincent's and try to get the MRI error straightened out. I had a $700 bill all in, and my injury was not noted. This resolution never happened. Phone tag went on for weeks. Eventually told I was being quote, referred, unquote, to Cooper Green to a neurologist because I had no insurance or source of income. Actually, I was being patient dumped by St. Vincent's and Complete Health, who did not want to acknowledge the truth of my injury. My next visit with Celeste Richardson in 2020 was a new low. Conversing with her very difficult. Seemed oblivious that I had any injury or prior injury history. Talking about this area of my neck and head. She was not open to my input. I took in printouts of the MRI CT frames showing the broken skull and massive infection. She simply asked me, where did you get those images? She did not want to see them, and I didn't believe I had a physical injury. Yeah, one thing that came up again and again is she seemed to believe that I had psychological manifestations, or I was perhaps imagining them or made them up. I requested anti-parasite medication and argued over this with Celeste Richardson. She wanted to take a blood test, which I refused. She walked out on me before the exam was finished because of this, and I was accused of trying to dictate my treatment for my efforts. Finally agreed to the blood test. I requested a detailed analysis of the blood for parasites, fungus, and other issues. She denied me this, and she made a offhanded comment that that was going to be expensive. Got the blood test back. Celeste Richardson dismissed some of the anomalies there, simply stress. And this was absolutely not true. You can see the MRI images. Had massive infection in my head and neck. Slowly and incrementally, my health was declining. Paid money went to these medical practitioners. My time was wasted. They were playing these games. I complained to the Northside Medical Associates office manager. She said the MRI people next door would contact me, but never did. I was denied a request for medical records from Northside Medical Associates Complete Health on the same day. Usually any medical practice will simply print out the patient's medical records right in front of them. It usually takes a couple of minutes. And you can sit there, you can watch the paper come off, pop out of the printer. They collect the papers right in front of you. They'll staple them, put them in a vanilla envelope, and they'll hand them directly to you. That didn't happen in this case. They said they were going to need several days to prepare my records before they would give them to me, and this is questionable. When I finally received my medical records from these visits, they appeared heavily edited with boilerplate disclaimers inserted, as well as curiously empty fields, etc. At this point, I believe that Complete Health, they knew that I knew I'd been mistreated. I believe this practice backed the misdiagnosis of their business partner Ascension, UAB St. Vincent's, Vulcan Imaging, and Dr. Michael Brant Ruff in a sloppy attempt at patient dumping.